it raining today?
Is it what?
Is it raining today?
It's raining in your video. It's not raining outside. Is that what you mean?
Yes.
You mean, is it raining in your video?
Yes.
Would you mind introducing yourself?
Okay. I'm Alex, and I'm Riker's mom.
Do you know why I am making a video with you today?
So people get a glimpse of what it is to raise a child like Riker.
And what is a child like Riker?
Someone who is considered a special needs child, or someone has Sturge-Weber syndrome.
Okay,
Someone who's not your typical child.
Yes, that is correct. Yes.
Okay.
So most of the questions I have are something that might elicit an explanation from you as to what it's like to raise a child that is special needs.
Mm-hmm. Okay.
So, if you were going to hire a nanny or a tutor or a babysitter to take care of Riker, what sort of things would you warn them about regarding him? Like what would you tell him? What would you tell this person that they need to do or prepare for like the worst case scenario? Hey. Calm.
Just stay with mommy.
No, you're sitting with me. You're sitting with me. Be calm.
I would say that they would have to be very patient and watch him like a hawk. I would say that...
Why watch him like a hawk?
Because he doesn't always control his limbs. He's like a cat. You know, he'll knock things off tables and and most of the time he doesn't know why he does it, or he feels extremely sorry for doing it, almost like he had no control over throwing something or knocking something over, or almost like it's too tempting for him to control himself, so he has to do the worst thing.
Mm-hmm.
I would tell him that he's kind of like a puzzle with like a million pieces, and all the pieces are like pastel colored. They all look the same.
You've described like the worst puzzle ever.
I know.
Okay.
But with that, it means like they would need so much patience. It takes so much to figure him out. But once you do, it's very super rewarding and
explain that. What do you mean it's super rewarding? What do you mean about the rewarding aspect?
Well, it's like, it's almost like it's like a game for you. Not a game, but it's like a problem. It's like a math problem or something, like a really hard math problem, and you're trying to work it out, and you're not going to get it right the first time, second time, third time, fourth time, 10th time. But when you finally do, then moving forward, you can just use that, moving forward, and then it becomes a little easier and a little easier to figure out problems like a math problem,
Daddy?
like that.
Oh, Daddy, attention! A water shower fell over.
A water shower fell over?
A water tower.
A water tower. Oh, okay.
Okay.
All right. Thank you. All right. Keeping a good boy. Keeping quiet. Okay. I'm talking with mommy. What else would you warn a potential tutor or babysitter or here, for example, he's going to be going into a new year of school,
Mm-hmm.
and potentially he's going to be having new teachers or new aides or a new behavioral specialist. What things would you tell that person? Obviously, they're going to be able to pick up some stuff on their own. They're going to learn as the job progresses. But if you gave like three things, like three important key items, like, hey, watch out for this, and watch out for this. What were those three things? It can be four, whatever. Like, what would those things be?
He doesn't talk. He doesn't speak like a normal, quote unquote, normal person.
Mm-hmm.
His expressions are, he speaks in, what we call it, metaphors.
Sure. So like he speaks in like some sort of symbolic way.
You know. He'll look at a situation and it'll remind him of something he's seen. Cover your mouth, vampire.
Well done. Okay.
Okay.
No. We're not playing that game. Nope. No, we're not playing that game right now. Thank you. Good bud. Good job.
He
Okay,
will, he will often.
You have to watch out for how he speaks.
How he speaks.
Okay. He speaks in like metaphors or something.
Metaphors.
Okay.
You'll need to watch out for his vision. You know, his vision. He's legally blind.
Mhm.
So he's not always aware of his surroundings. That might have to do with a lot of why he bumps things or knocks things over or flinches or doesn't know what's coming at him.
Sure.
Let's see what else. He's got a lot of energy. You just have to run with him and keep up with him.
Okay.
And your reflexes have to be really good.
Okay. So reflexes, he has a lot of energy, vision problems, and he speaks differently than other children.
Mm-hmm.
All right.
Mm-hmm.
Okay. You've covered some of the basics of like a warning system if you were going to be warning someone about like handing him off to them or whatever. And before, I'm not handing you off, calm down. And before you hand him off to someone, like, here's a few things you'd give him a tips.
Uh-huh.
All right. Some other questions. What are some difficult things about Riker? Like, what are some things, these kind of seem like warnings, but different. Like for you personally, obviously, if you hand him off to another person, they're going to have some difficulties.
Right.
You've had almost 6 years of interacting with him. What are some things that you still struggle with that are difficult for you, where you're interacting with him and you're kind of like, oh, this is rough. I'm having a bad day with him.
It's difficult for me as a mom to not feel sorry for him.
Okay. Explain that.
He's capable of so much more than I give him credit for. But because of this diagnosis that he has, the Sturge-Weber syndrome, which is such a wide spectrum, severe, mild, some people just have the Ports-Weinstein, some people have seizures and are blind and, have lost use of their left side, because of the seizures. So because there's no definite symptoms to Sturge-Weber's.
You mean there's not like a specific definition it's covering? Okay.
It's not a specific thing. Like if you say this child has Sturge-Weber's and this child has Sturge-Weber syndrome.
I want to play that
leave
really good time.
Please leave. Okay. Please leave the car alone for now.
Hold on, buddy.
You're being very well. You're
Yes.
being very good. Keep sitting. Okay. Thank you.
Yeah. So if you said like two separate children had Sturge-Weber syndrome, it in no way means the same thing.
Mm-hmm.
So in my head, there are so many things that I assume he can't do because, he's got this disability. But in reality, he absolutely can.
Study.
So it makes it really hard to discipline him because sometimes he can't help some of his behaviors and sometimes he can. So it's hard to kind of figure out which is which. And also it's hard to figure out what he can learn and what he can't at the moment.
Is part of that fueled by your pity or sympathy from him?
A lot of sympathy.
Okay.
Like I never. One of the things that I don't want to do is be hard on him and blame him and make him responsible for something that he absolutely cannot help.
Sure, that's my job. Yeah.
Yeah, pretty much. That's
what I have to do.
You're much better at figuring that out than I am. I am always gonna take the cautious kind of.
Maybe he didn't mean to.
Yeah,
maybe he couldn't help this.
He couldn't help it because sometimes you think you're like, my kid is not a bad kid. He's not an awful kid. He's not a mean-spirited boy.
Sure.
So some of the things that might seem that way, I'm just like, he couldn't have meant to do that,
Mm-hmm.
And so that's one of the big struggles that I have with
the difficult thing
him.
that you have currently still is that you're maybe overly sympathetic or you're assuming he's worse than he is, kind of.
Yeah.
Okay. All right. Or at least,
it's sad because, it's sad for him because I'm not giving him enough credit.
Not able to test what his limits are, essentially.
Right.
Yeah.
He's capable of doing so much, and sometimes I don't think he is. And that's the struggle with this type of disability,
Mm-hmm.
you know, not knowing exactly what he is capable of yet, you know, thinking he's might not be capable enough for certain things when he could absolutely be capable of it,
Sure.
you know?
So is there, sorry, I didn't mean to interrupt you, but is there something in that where since you're always kind of left assuming he's incapable of something, do you find yourself then pleasantly surprised constantly when he's able to do something you didn't think he could?
All the time.
Okay. Yeah.
All the time.
Yeah.
And it's something that I mean, I always, unfortunately, I always expect the worst
Mm-hmm.
and hope for the best,
Okay.
as opposed to, you know,
Sure.
so I'm never disappointed.
Oh.
And it's not the best. I don't think it's the best way to live, because you're always expecting the shoe to drop. You're always expecting bad things to happen. You know what I mean? So you're not
Sure.
completely, so you're prepared and you're not completely like, oh, but yeah, when he shares with other kids, when he like is able to be sociable with them, and you know, I'm just kind of like, oh wow, he
comes home with
absolutely can.
he comes home, mission
Uh-huh.
accomplished. Yes.
Yes.
He comes home and the teacher has said he did not run into all the other children.
Right. He
Yeah,
didn't
yeah.
try to run out of the classroom and anything.
It does the Mr. Accomplished
Mm.
that could be surrounded.
That car was
Mhm.
surrounded, so you said mission accomplished. Okay. Thank you very much. Okay. keep quiet. You keep quiet. I'll eat that tummy of yours. All
You
right.
cannot eat that tongue.
I could eat that tummy. All right, this is a harsh question, but I'm going to ask it anyways. Do you ever have a time or has there been a period since he's been born that you ever wished he wasn't born?
No.
Oh, that's okay. You mind explaining that a little bit? I mean, because during the first 6 months of his life, it was pretty rough. You know, he had a lot of surgeries. He was in a lot of pain. He was constantly going through something. There were periods with seizures, and then we're looking for seizures, and then like we're just like, this kid's gonna die. You know, like.
I never thought he was going to die.
Okay.
I allowed myself to, you know, right away love him and consider that he's going to be permanent. You know, right away I was like, you know, he's, you know, this is our child. He's, you know, and then I also took a weird thing, because I'd always like prior to this been like, what am I meant to do? Like, am I meant to be an actor? You know, am I meant to, you know, teach kids at school? Like, you know, all these things. And
like, what's your lot
what's
in
my
life?
purpose? Like,
Okay. Sure.
what's the thing that what assignment is mine
Mhm.
in this life? And for a long time, I was like, well, you know, I'd want to work with special needs kids before he was born. Like, I, you know, would love to work with the Down Syndrome Center or something, you know. And then when he was born, it was like, oh, I have one of my own.
Mm.
And then I was like, maybe this is one of the things that I was meant to do, is to raise this child that is having so much difficulty that's going to consume a lot of my time. You know, there's not a day where I am without him that I don't think of him.
Oh, so any time where he's like at school or he's away or he's with
And
me or
I'm
something,
and
you're
I'm
like,
doing
what am I
an
supposed to do
errand.
now?
Yeah, yeah.
Mm.
And what's an errand? If I run an errand, and like, you know, if I'm supposed to go shopping for myself and have like a day, it's
Sure.
never about me. It's always like, oh, this would be great for Riker. Riker would love that. Oh, I should get that for Riker. You know.
I see.
And so it's just my whole.
Maybe I should go and play.
Not yet. Not
Hold
yet.
on, buddy.
We'll go play soon. Okay, you're being very good.
It's like my time
Here,
is
put something different on.
all my
But-
time is consumed with the boys, and then, you know, because Bishop's very like
No.
self-sufficient, and he's, you know, 11, and he's, you know, he's grown.
understands what he needs to do.
Needs to do.
Sure.
There's my attention falls, my mind falls to him, and you know, what, you know, how are you going to be with him by yourself when I'm not around? And it might just be a complete mom
Sure.
thing, because I've talked to other mothers about this, and they feel the same way when they have to leave their kids with the dad. They're like, the dad's perfectly capable. The dad's totally good with them.
Sure.
Why do I feel like I have to worry so much about whether
Is that
they're
a
all
thing?
gonna eat?
Is that a thing you do all the time? Yeah.
Yeah, I'm
Really?
always worried about like food for them, and if they're gonna get if
I
he's gonna
love
get
that,
dressed
Daddy.
correctly
Sure.
for the weather, if
Sure.
he's gonna get his medication.
That's fair. That's fair. I forget medication often.
Yeah, which
Okay.
is, but yeah. So I always have to like remind or like leave notes or like put Ziploc bags around and stuff. And so
Mhm.
yeah, I'm always worried about that. Even though you've shown me time and time again, there's absolutely no reason to worry. He's alive. He's well. He's he's as healthy as he can be. And
I put him in cryogenic sleep while you're gone. Yeah.
right. And so yeah. So it's just something that I constantly is on my head, in my mind. And so I feel like, okay, this is my job now. This is my purpose for now.
That's really interesting
Yeah.
that your purpose ended up being, well, or whatever the purpose that you've kind of stumbled into happens to be similar to the purpose you projected you might have for yourself. You know, like you kind
Isn't
of
that funny?
you kind of got rolled that
I
very
know.
sporadically, but
I keep thinking about that The Secret.
This is
The
life.
Secret is like it was a weird thing
is this
where
a
you
movie or-
manifest. No, it's like it's not a religion, but it's like a way of thinking where you like manifest something in your head and then it happens. It was a weird, like,
no,
it was
was
a big,
this in the
it was
90s or something? Or
no, it was like in
Okay.
the early 2000s, I think. It was
Okay.
like an Oprah was like the thing that, like,
Okay.
and so
some way to co-opt religion or something like that.
something like, if you want something bad enough, you have to manifest it in your head, and you like, you say it, and you affirm it, and you do
Sure.
affirmations, and then it happens, right?
Sure.
So it just reminded me of that. Like, oh my gosh, I totally.
I've never heard of that.
Oh, okay.
No, okay, sorry. All right, what else do we have here? Let's see. So Riker was born, and pretty much immediately any aspirations you had to be an actress or to work at your theater or to spend time with friends or to to have the life you used to have was pretty much, well, everything kind of changed, so
It did.
Okay,
Oh, and
good.
I'm sorry. I
Good.
don't think I quite answered the question before when you were like, do I ever wish he wasn't?
okay, well, you did, you said no.
I said no,
Okay.
but there's
Good.
a little bit of so I have pictured what it would be like without having another child.
Hmm.
I've had like thoughts of like, well,
Like what it would be like without Riker.
yeah,
Okay.
if we didn't have a child together.
Okay.
Like
Okay.
I thought, okay, well, I would probably be doing this or
Mhm.
I'd be doing that. It'd be easier for us to like go on vacation and like,
Sure.
I definitely would have a 9 to 5 job
Hmm.
that would have to go in and do it, and but I never at that moment been like, my life would have been better.
Okay.
So it's weird. It's, and I don't think there's anything wrong with like, going through life and being like, oh, I wish this didn't happen. Or, at certain times, because certain times things are just so hard and you're just like, I just want relief. I just want things to not be this way and stuff, So I'm not saying that that's a bad thing. I'm just saying that with him, I don't think I've ever had the thought of like, oh, if he just was not here, things would be better. I know things would be different.
Sure. That actually segues well into my next question. You almost answered it entirely, which is, would your life be better or worse without Riker?
Maybe
Or
worse.
has your life been better or worse because of Riker? You can phrase it whichever way you want, but
I think it's been better. I think I've become a better person. I've become a stronger person.
explain that.
I still have
Like, what do you mean? How do you mean you've become a better person?
a better person in that I feel like if he wasn't around, I would have been much more selfish.
Okay.
I would have put my needs above other people.
Hmm.
I never really acted that way, but I feel like if there was nothing to stop me, no obstacles or anything like that,
Is
like
that mouse, Daddy?
Yes, it's a
Yes,
mouse.
it's a mouse.
Yes, it's a mouse. Here, put it back down. You can see it.
you can hear it.
Okay.
I feel like I would have been much more selfish, maybe
Focused on you.
focused on me, focused on what I wanted to do and what I needed, and which there's, I mean, you know, of course you need to focus on yourself and stuff, you know, every once in a while. But I feel like with him, it really, I've learned so much about medicine and children and hospitals. And so I've kind of grown up, actually.
Hmm.
That's what it is. With
Okay.
him, it forced me to really grow up.
Yeah.
Because now I'm responsible for somebody else, not just myself. And
And a helpless somebody else.
yeah, someone who's very helpless. And, you know, I know more about the education system now, and the special education system now, and I know more about different therapies and more about, like, you know, which hospitals are the best hospitals, and, you know, what programs would work better for him. And I just, there's all these things that I just feel more knowledgeable about things. Whereas before I was just kind of like, I'm just gonna, you know, learn what I have to, and I'm just, you know, whatever. And, you know, I'd probably still be trying to be an actress. And I mean, I don't know where I'd be right now, but I'd probably still probably be trying to pursue that. And, you know, going from audition to audition every day, and you know, 3 auditions a day, and
hi diddly dee.
yeah, exactly. So no, I think I definitely am settled. I'm like, got a home, I've got a family, I've got dogs. Like, it's something that I never thought I would have, because I didn't think I was grown up enough.
Say that again. So just say that straight.
So, I mean, I have times where I don't feel like I'm a grown up, like an adult, like, definitely. But prior to this, you know, back when I was living paycheck to paycheck trying to be an actor, I was like, wow, I'm never going to afford a home. I'm never going to, you know, how am I going to, if I can't afford a home, how am I going to have kids? Because it's something I wanted. And, you know, will I ever have a dog again? Like, all these things, because I just didn't feel like I was grown up enough, adult enough. You know, I didn't have that. I didn't have the maturity to have all these things. And I never thought I would, because of the life I was leading, and, like, you know, where I was headed. And so I think he grounded me. And I really do think that this is what came of having a child together. All of this.
Well, we certainly wouldn't have gotten this place specifically without him. Like, when we were picking out homes, we had to keep in mind that we needed a place where he could live inside all the time. So there had to be just enough square footage and area for him to run around. And we had to sort of design this home around the fact that he wasn't going to. Hold on. I'm talking about it. Hang on.
Is that Simba?
That is Simba. Yes. Thank you. We had to design the home around the fact that he wasn't going to be able to go outside. And, you know, so like that was, we discounted the need for having a yard based on the fact that, like, we can't really spend a lot of time in the sun.
Right.
So that is correct. We would not be in this location specifically were it not for him.
Right.
You know, we might have picked a different place when we were looking for homes.
Smaller home.
Sure. Something else, maybe less square footage, maybe a bigger yard, different neighborhood, whatever.
Yeah.
So I would agree that he shaped our focus. So, let's see. All right, if a different person were pregnant with a child like Riker, like, let's say they were pregnant and they had gotten a test back that said your child's going to be disabled. So this person knows that they are pregnant with a disabled child. What would you tell them?
That's hard.
Why? And to talk a little louder, because sometimes it doesn't pick you up.
It's difficult, because I don't know what their situation is in life. I can only tell them what I've experienced.
Okay, so do that.
Which is, I mean, it's pretty much what I hear today. I've experienced so much joy, so much pain, but the joy outdoes the pain. It's so hard, but every little, like, success that this child has, every milestone it makes, every like, it's just that much more rewarding because you know it's twice as hard for someone like that to get there.
Hmm.
You know,
Sure.
he's like the underdog, and you're always like rooting for the underdog. And I feel like
some Disney sports movie.
Yeah, like a Rudy.
Yeah, sure.
But it's such a rewarding experience, and just if you give the child a chance, they'll surprise you. They really will.
Sure.
I mean, that's my experience with it. I think that's what I would do. I just tell them my story and then let them figure out what's best for them, but I let them know how it affected our family and how positive it was for us, and let them make their own choice.
Sure.
And
I see you're very tentative along this line. Like, you don't want to be telling anyone what to do. Or I understand that.
Yeah.
It's difficult to estimate exactly. No, thank you.
Is that talking?
Is that what?
I don't want you to talk.
I am going to talk. It's difficult to account for everything that could be going on in that person's life and make some extrapolation or some determination what they should do based on the information you have or what your life is like, because it's like you're kind of guessing at their circumstances.
It could absolutely be much more hard.
Sure.
Much harder for them to.
Sure. Or they could have someone like that child that we met, Jackson, where everything went worse and everything went into, where the kid ended up being 4 or 5 years old and was in a puddle of seizures his whole life. Right. I mean, that's something I consider all the time.
Yeah. It's so painful for,
Thank you. No, leave those things. Thank you.
And you know what? No. It's different. I think it's different for parents who have had one quote unquote normal child and then one that has special needs.
Okay, explain that.
They're always comparing.
Is that a good thing? Is that a good thing or a bad thing?
It's a bad thing.
You think so?
I think which is weird. I think it's more difficult because,
so you're saying if you have a normal child and then you have a disabled child, more difficult. Is that what you're saying? Is it more difficult than if you had?
I would think so, because in my experience, him being my first biological child that I've been there with from day one, all these things versus Bishop, who didn't have to be in the hospital, in the NICU, didn't have to have a surgery at 3 days old, didn't have like a hard time breathing because he was intubated. I just kind of went with everything that was going on with him, not having anything to compare it to, thinking this is just how it is. Much like him.
Sure.
Like, he's just like, I'm sure every child has to have pressures taken, and he doesn't know that he's different.
Well, I've asked him, like, are you disabled? He's like, no, I'm all better. I'm fixed.
I'm fixed. I'm mended.
I got mended. Yeah. Has no idea that he's.
No. And
so you're saying if you had a second child that you'd had first, so if you had had a first child that was normal and you had all the experiences with that child going up to it, and then had this child, it'd be harder.
Yeah.
Okay. So there's some benefit to the fact that you weren't around for Bishop's whole life and didn't have a comparison to that.
Yeah.
Okay.
Yeah. And people ask me, I have friends who've asked me, they're like, how do you do it? How did you get through it? And I was just honest and was like, honestly, I didn't have time to feel sorry for us because he was going through surgery to surgery, hospital appointments, everything.
Sure.
And the doctors just kind of tell you what to do and you just follow the instructions. But two, that I don't know what it's supposed to be like. As far as I'm concerned, this is what it's supposed to be like when they're born.
Sure.
So, so I always feel like that's an interesting take on it. I mean, yeah.
Okay. I think I have 2 more questions for you.
Okay.
So 2 years ago, we were not going to church. We were not Christian. I'm trying to think of the framing of my question. What would you, if you were to try and determine something let me start over again. So 2 years ago, we were not going to church. We were not Christian. And last year we started going to church, and we've continued going to church for almost a year now, or a little over a year now. What do you think you would attribute I don't know what the question is exactly. What do you think it is that has compelled us or driven us towards Christianity? Do you find something in our lives? And it might be a leading question. I guess I'm asking, do you think Riker is one of the reasons why we're going to church?
Now I do.
Because I phrased the question this way?
No.
Okay.
No. Because I mean, I'm going to be completely honest. I never thought of church as a, thing that would be in my life, or like Christianity. Really, I always thought my relationship with God is fine.
Mm-hmm.
Like, I believe that there's a God, and I'll talk to him occasionally, and
but you didn't need to go to church.
Yeah, exactly.
Okay.
I was like, no, my relationship is my relationship.
That is a right.
My relationship is my relationship. No one needs to know it's
Sure.
It's personal. It's between me and God. So when you were like, hey, let's go to church, I was like, well, I'm gonna do this because you want to go to church.
Okay.
And and I'm not gonna expect anything from it. It's in my head, I had built this church to be like, fake.
Okay.
And like not real, and
like the televangelist
like
churches
money.
or something.
Yeah, just charging money, and like people,
So they're like a scam.
Yeah,
oh, okay.
That's what I used to think of churches.
Yeah.
And I grew up Catholic, but not really. I was I'd go to church once a year maybe with my family, and I was baptized as a baby, and all that. But I never read the Bible.
Mm-hmm.
I knew like the basic stories, like Noah's Ark, and the birth of Jesus, and
sure.
his crucifixion. But
any of the ones Hollywood's made movies about.
Exactly. And so at first I was like, all right, we'll see how this goes, and it looked like it was something that you really needed.
Okay.
Like, it really felt like this was something that you had to do.
Okay.
With your history and all that. So I was like, yes, I'm going to be supportive. I'm going to go. And then when we found out that they had a Sunday school, for Bishop to, go to, and then one with Riker, where like one of the leaders of it was like a special needs, had experience in special needs, and knew exactly what Riker would need, and it was just kind of like, wow, this church really fits. And if I'm not finding the sermons or any, interesting, at least the boys are benefiting from this.
Mm-hmm.
At least you're benefiting from this.
Okay, so it could help everyone else but you, and you'll
yes,
just okay.
Yes, and I will.
That's very sweet of you.
And I will do that. I will go and and listen. But then, like, after going for a few weekends, I absolutely adored our lead minister, Alan.
Okay.
And was like, wow, this is it's not boring.
Mm-hmm.
It's interesting.
Sure.
And he's delivering this with, he's very charismatic, very like, this is exciting to learn. And it kind of felt like I was going to class.
Well, like a lecture class. Or something. Sure.
Yeah. Like a history class.
Sure.
And so
he does a very good job of making a complicated subject broken down into a story that you can relate to.
Exactly.
Yeah.
Exactly. And he was, he's cool. He got tattoos on his arms, got the South African accent, and
sure.
and he talks about rugby and it's just really cool.
I like you try to say it with an accent.
Rugby.
Yeah.
And he's just seemed like a very cool, laid back person who just wants to have a conversation with you.
Sure.
And not so much like, you're bad people and you're bad, which might be a Catholic thing. I don't know. I feel like in the Catholic
the judgment
Church,
system.
Yeah, I feel there's a lot of judgment. You were brought up to fear God. At least I thought I had to fear God.
Mm-hmm.
But he kind of was like, hey, yeah, he made everything comfortable.
Okay.
Sure. And so I started like, after going, I was like, wow, I'm kind of, I'm happy to go, and I'm happy to like learn things, and I'm, reading the Bible, and doing the little study books with your aunt, and um, just finding things that are very interesting and in the structure of the Bible. And, I had no idea that there was a section in the New Testament where like four different people, tell you the same story with their own versions of perspective, which
Sure.
is, which is pretty cool. So it, and then, going to the women's group every Tuesday and kind of just being around a lot of positivity.
Okay.
I think that's been very helpful.
Regarding him specifically?
Yeah.
Because initially that was my framing of the question.
Yeah.
Is he something that brought us to church? Because again, it's a leading question because I know that he is the reason for me why I'm going to church. Like I would have never gone back to church if it were not for him.
Oh, okay.
Oh, not a chance. So,
oh, okay.
such a negative experience at church,
Right.
that I had written it off entirely. I had written
Yeah.
off God and religion, but when he was born, I was like, I don't know how to deal with this. Like there's something, I need something more outside of me to fix this thing.
Right.
Anyway,
I wonder if it's because you had Bishop that was so difficult. Like,
Bishop was a really easy child. I mean, there was some things I had to learn and change about myself a little bit, but I could still play Hearthstone for 3 or 4 hours a day, and he would just watch and engage. And again, he's a really easy kid.
Yeah.
So for me, he was like this. When you're in the desert, you have this stick that leads you to water. I think it's a winnowing stick, divining stick. I don't know. Anyways, he was like this stick that leads to water. He was like this thing that goes, you'd better find God because there's something wrong here and the doctors can't fix it. So I suppose I asked that leading question to kind of like, was it the same for you? Like, is there something about him that when I think about like how his brain works, the left and right half not speaking together, in my mind, it's absolutely God stitching it together, because I've seen what it can be. I've seen a kid who has his same symptoms, his same disorder, and that kid's in a puddle on the ground. Mm-hmm. And, I know that that's potentially what he could be at any point. And it's kind of where he was going towards. And we sought prayer, and we sought out people to talk to God on our behalf. And then suddenly all the surgeries started working. Suddenly we were going from, it was a Tuesday we'd gotten one surgery, and a Thursday when we realized we needed a second surgery to make up for the Tuesday surgery. And it was like, then prayer happened. Yeah. And it was almost immediately that there was the surgery where his retina popped out of his eye, and we had to go to a different doctor. And I was like, I don't know what to do with that. I don't know how to place that somewhere. So
I think church, or going to church, also gives you a sense of things kind of making sense. Or it kind of gives you an explanation for stuff. Because the not knowing is just the worst. It's just so hard when you don't know what's going on, what's supposed to happen, what just happened. And so there's a comfort, I think, that a lot of people, and I understand this now, that a lot of people look for in church and in God, just because they want an explanation. Even if the explanation is like, God knows what's going to happen and he has a plan. We just have to trust it.
Sure.
Even if that's the explanation, it's better than having no explanation at all.
Just some series of random coincidences.
Exactly. Because, and it's hard. It's hard too, to be like, why do bad things happen? Of course, like, and that was something that I really struggle with religion, and I still do. I understand. I'm like, why do bad things happen to children? And, it's just,
sure.
And then you just have to, keep telling yourself that it's not in vain. Like something, God, there just has to be something bigger, like something. I know the world's not that cool. Like there's got to be a reason. There's got to be something more out there. Because if you start thinking that, you might as well just die, like kill yourself. Like,
Sure.
because
Very much get wrapped up in systems of despair,
right,
without
exactly.
without the knowledge that something in the universe loves you unconditionally.
Something,
Yeah.
yeah.
I get that.
So,
I'm off topic a little bit
oh,
here.
sorry,
No,
sorry.
it's okay. No, I wanted to stay focused on a discussion about Riker and
Yeah.
disabled children, and
Yeah,
I did leap into church and religion, and we'll talk about that. Well, maybe we'll do another one of these to talk about our
Sure.
experience going back to church.
sure.
Um,
But yeah, I find myself praying every prayer that we're asked, or every time we think of like, every time we're like, we want to ask someone to pray for us, it's always for him.
mhm.
Always. That's always been my thing.
Sure.
Every time I go in there, we do the worship and singing and stuff in my head, and there's time to like, just take a moment and pray. And
Mhm.
I'm always praying for Riker, really.
Well, you sort of gave the answer to a question I was about to ask, or at least it was
Do that a lot.
similar. No, it's okay. It's related to worshiping God and our experience going back to the church. But recently we were at the church and we talked with one of the pastors there, Matt.
Matt.
Yeah, we talked with Matt, and he I asked him specifically, can you help us, because Riker's going to be going to a new school, and there's a lot of in between and where he's going to go, and the teachers aren't really responding well to our pleas for for assistance or whatever. So okay, hold on, we're almost done.
Almost better.
No, you're
You're
doing
doing
really
so
well.
well.
You're doing really well. Anyways, he prayed for us, and I just want you to do what you can to talk about that. Like we had this experience where Pastor prayed for us. He knew our son's name. It was very interesting, like the way he prayed, and then we went on through our week and described it.
So we had been struggling with Riker's IEP and the IEP team, which is this individualized educational program, IEP, and the team of teachers, past and future, present and future, like teachers that are kind of with him right now, plus the teachers that he's assigned to go to. They just weren't getting his needs, or what he really needed, what we were requesting, what the parents were really saying about him. And we had an advocate go in for us, because the IEPs tend to be like essays and complicated, and like 50 pages that you have to small print, you have to read everything, and like things don't make sense. So we were like, up until then I was always like, okay, you're the experts, you know what's best for Riker, like his education. And after reading it, like really spending time and reading it for a while, it was kind of like, well, no, what they're giving him right now, it's not working. He's not meeting any of his goals. So we had a meeting with the team, and they got really defensive. They were not doing anything to accommodate what we wanted for Riker, what we thought was best for Riker, because in the end, we are the experts on Riker, right? Not them.
I would hope so, but
Sure. But I mean, it's true. So we were kind of lost. He was going to go to this. He was assigned to this school that was, he was going to be the only young kid going into a learning center with a personal aide. So he's going to be like almost ostracized from like the other kids. An aide was going to have to follow him around, and the other kids were just going to kind of be sitting there at lunchtime, maybe whispering about him, talking about how he needs an aid, and it was just not going to be a positive
those are our
experience.
fears, at least.
Those are our fears, right? Yeah. And then when we went to church, we asked Matt to pray for us, and so at first he started talking about he just wanted to give us like love and have God hold us in his hands and stuff. And so I was like, all right, he's going to give us a general prayer, like,
sure,
right. And then he went into specifics on Riker and even called Riker by his name. And I think maybe the last time I said Riker's name in front of Matt was like a month ago, or
Sure.
So I didn't expect him to remember Riker's name, and he absolutely did. And he was he prayed for us and prayed for like guidance for us, and to hold what's best for Riker, in put Riker in God's hands, and like have him work with him and with us, and give us like the relief that we want. And then the following week, the director of the special education program of the actual district called me up and apologized for for the IEP team, and
Yeah.
where they made mistakes, and how, you know, our requests weren't being met, and how Riker's needs weren't being met. Unfortunately, he had to miss the meeting because he had another meeting to go to, so he had someone fill in. But when he heard about it, he felt sick to his stomach, and he was like, let me get in there and talk to them, and get you what you need. And, you know, and I asked for a tour of the new campus, and he met us there, and he got candid with us, and he was like, look, this is off the record. As a parent myself, I wouldn't put your kid in this school.
That was really,
And that was,
yeah.
we appreciated that,
Yeah, that
because
was so
we were
nice.
like, all right, we have to homeschool him because this is not the right place for him, you know? And he was like, no,
And here's what you need to do.
Here's what you need
Yeah.
to do.
Yeah.
And he told us exactly what we needed to do. And he recommended the schools that he should be put in. One was the one that he's in now, which is great, because then he's familiar with everybody and everybody knows him. And so now we're in the process of getting him to just stay where he is. And he's actually going out of his way to find a teacher who will actually teach him Braille. And he even said that if he couldn't get one, he'd contract one out.
Sure.
And so we were just so grateful for that. And we were just like, oh my gosh, this was such a weight lifted off our shoulders. We could actually breathe a little bit, knowing that we have someone who's actually listening to us and on Riker's side, who actually has input and say in what Riker's education is going to be. So it was like a miracle. It was like,
it was a pretty strong turnaround from what we went into the weekend knowing, given that they were like on Friday we had the meeting. It was like Saturday we started getting emails from them, and we still had the indication that they were not going to accommodate. They were not going to change their mind about this. And it was a pretty if I weren't a person who believed in God, I would have to consider it to be a very strange set of circumstances.
Yeah.
You know, so anyways, I don't think I have any other questions right now, and I'm gonna cut this short because this is already going into like almost an hour.
Oh my gosh.
Thank you for chatting with me for so long.
Sure.
So normally I take a lot of time to edit things down and chop things up, and this one I probably will leave almost entirely as it is. If you're still watching the video at this point and you've enjoyed this discussion, I'd appreciate if you could comment or ask questions to give me an idea of, you know, another video topic. But I appreciate you being here. Thank you so much for watching, and you know, leave your comments down below. Go ahead and say goodbye.
All right. Thank you for having me. Well, I live here.
Yep.
But
It's just so awkward.
I know. Yeah. So hit subscribe and leave comments and questions, and we're so happy to talk about Riker and our experiences. If we can help anybody,
that's actually a good point. If you're someone who's just had a disabled child, and if you're struggling through figuring out some of the early steps or things, Lex might have some answers to those things, because she's
mom.
She's
tends to be different from moms than dads a little bit. So, but
also she's done a lot of the technical stuff as far as getting him medications or dealing with doctors or the schooling things, and you know, I guess that's my way of saying that I get to sort of be spastic or delinquent in some of that regard. Anyways, we thank you for being here. Thank you for watching. May God be with you.